Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. How are you doing?
Hi, Allison. Great to see you today.
Good to
Um,
see you.
and which episode, do you know off the top of your head which episode we're in?
Either 39 or 40.
Um, we started this in April of
Mhm.
2020,
Yeah.
the infamous 2020. And here we are in 2021, continuing with In the Sterilization Room with Jackie. And
Mhm.
as we were talking and getting ready for this video, I communicated to you, well, we've talked about all of the infections and the number of vaccinations and what are the statistics. And I thought, let's get back to the sterilization and the infection control part that really is the heart of us doing these videos for the orthodontic profession.
Yeah, exactly. So I know you wanted to take a step back and look at how the orthodontic office is managing their infection control, especially aerosols. So what have you been hearing?
Well, we've gone through a lot of data and research, and it was back in April and May and June as offices were reopening after closure. There was a lot of experimenting going on. I
Mhm.
mean, we just tried everything. Air purification units, putting them in the bay, putting up barriers in between the different chairs, looking at the heating and air conditioning system, and even experimenting with, can we do bondings without generating aerosols?
Mhm.
How can we do any of that? So there was a lot of experimenting going on, and wherever there's a need, then research follows.
Yeah.
And so there has been considerable research, and now we're finally getting that research published.
Mhm.
And so we have the data, what's effective and what's not, going back to evidence-based science with it. And I just found a article that was published recently in the last couple of
Mhm.
weeks
Mhm.
from the Journal of Periodontology. Now,
Okay.
I know that's not orthodontics, but it's a great summary article published by 3 periodontists on the status of research, what are the different aerosol mitigation protocols that we can use in the dental profession as we're generating those aerosols. And as I was looking through, it talked about PPE, of course, with
Right.
masks and shields, and then it talked about pre-procedural mouth rinses and
Mhm.
sterilization and disinfection and even dental unit water lines. How do you control the biofilm in it? And then I came to the topic within this article on high volume evacuation.
Mhm.
And it really resonated with me in looking at the ortho office. And we haven't talked specifically about high volume evacuation in general in the
Right.
office, except we did touch on with the extraoral vacuum suction lines and are
Mhm.
they effective or not. So I thought it was time, let's use this article information and talk a little bit more about evacuation
Mhm.
and how effective is it with the aerosols and what should the team be doing um, with their evacuation lines in the orthodontic office.
Okay. Well, so just to get started, what does a practice need to know to get the most out of their high volume evacuation? What should they be doing?
Well, I'm going to go back to my almost 40 years experience in the dental profession.
Mhm.
And, often we're using suction as we're treating the patient, and there's slow speed suction and high volume suction. Now,
Mhm.
many of you may know the Mr. Thirsty or the saliva ejector is the slow speed suction, and it's pretty gentle and just removes the saliva as it pools in the bottom of the mouth. And it doesn't really provide us with a dry field.
Mhm.
To remove the greater volumes of saliva, especially in the ortho office, they've used high volume evacuation. And you may be familiar with an item called NOLA suction. And
Right.
NOLA suction, it's cheek retractors attached to tubing that removes all of the saliva for the entire mouth and allows the orthodontic assistant, the orthodontist, full access to the mouth and keeps the teeth dry as they're doing an initial bonding. So imagine they're going to put brackets on all of the teeth and maybe even molar bands on some of the molar teeth. It keeps a dry feel so that they get a good bond. You're not going to lose those brackets. So it's essential, but it's a complex device and it's very difficult to clean and sterilize in between patients, and it's a little uncomfortable for patients. Patients are cooperative because they want straight teeth, but it's not exactly a comfortable device either to do it. So again, that evacuation from it, and as I've consulted in many offices, even when they're using NOLA suction or maybe just the slow speed evacuation, there'll be one chair in the office that none of the assistants want to work at because it has wimpy suction. It's usually the one that's the furthest away from where the vacuum pump or the utility closet is. Now, that's what I didn't talk about at the very beginning. That suction happens because we have a vacuum pump in the office and it pulls the air through and it goes through the suction pump. There's a filter at the orthodontic unit and then another filter in the suction pump that collects any solids, debris, whatever that may be going through those lines. So you can imagine throughout the day, and a busy ortho office, it's seeing those 80 patients a day, and whether they're using slow speed or high volume evacuation, all of that oral fluid that's going through that suction, it could get pretty yucky, clogged up inside of there. So the suction should be cleaned on a routine basis to remove any debris that's going to adhere to the walls and the suction and to keep it operating optimally. Now, when I said at the very beginning, I'm going to go back to when I first started working as a dental hygienist. In the office that I was in, one of the assistants who had been cleaning the trap, if you will, the filter that was in the vacuum, she left the office. She was gone. She had a baby and didn't come back, and nobody else took over that job. So 2 or 3 months later, we came in and we turned on the vacuum pump and turned on the water, and there wasn't any suction. The lines had gotten so clogged and the filters had gotten so clogged that it had actually burned up the vacuum pump, if you will. You know, the common term, it ceased to function. So we had to buy a whole new vacuum, not an inexpensive thing. Had to get the dental service. We were shut down for a while until the dental service technician could get there with a vacuum pump and replace it. And then we had to clean out all of that debris that had built up in the lines. I'm not going to tell you what a mess it was. It took half a day to clean that up. So routine maintenance would be cleaning. Now, in a dental office, it's recommended you clean the evacuation lines every day. And that you use a neutral pH, not acid, not alkaline. Remember, this is for dental because they're removing silver fillings. And that acid can leach out the mercury and contaminate the water system. Not as important for us in the ortho office because, of course, we're not removing fillings. So any oral evacuation line cleaner will be effective and is good for use in the orthodontic office. And as I said, I would recommend at least once a week, if not every day. Now, another big error that I see happen when assistants are cleaning the evacuation lines is that they just get a big bucket or a container and they mix up enough solution and they go from one unit to the next and they suck up a volume of the fluid through there. To get the greatest cleaning ability, the evacuation line cleaning suppliers actually provide what is called an aerator, if you will. And it actually has a outlet on the top of that unit. So you put the cleaning solution in the container, put the lid on top, and then you put the slow speed evacuation on the smaller line and the high volume evacuation on the other larger line, and you suck up all of that cleaner that's in the container. The way that it goes, the power that it takes to be able to suck up that cleaner when you're using the evacuator cleaner attachment, the aerosol device with it, actually provides more cleaning inside the tubing than if
Mm,
you just put it into a bucket. So you do need to use the evacuation device when you're cleaning the lines. And as I've said, clean at least once a week. Check your traps. Maybe the traps on the units need to be changed once a week, once a month. It depends on how frequently you work in that office. Maybe it's a satellite office that you're only in 3 or 4 days a month.
okay.
So it wouldn't need to be cleaned as often. But to make certain that you have that on a maintenance and that someone is checking the filter on the vacuum pump
Mm,
and it doesn't drop off. So that needs to go on that weekly and monthly maintenance with it. So maintaining the lines is important. And you need to test your lines to see if you are getting a maximum amount of suction.
okay.
Yeah, and that most offices have never even thought of that. And I read in this article, the Journal of Periodontology article that had summarized everything to establish what your baseline is by actually taking 8 ounces of water. That's
Okay.
about a cup of water, and see how long it takes for the suction line to remove that. Does it
Okay.
take 2 seconds or 20 seconds? And
Hmm.
that's your baseline, and you should test your evacuation lines on a routine basis and see if all of the chairs have the same amount of evacuation power, of
Okay.
vacuum power for it, or is it declining, meaning that
Mm,
either your pump is not operating optimally or the lines are clogged, the number of things. And you may even have to have a service call
okay.
from your service technician to come out and help you. I know when I was in one orthodontic office in Orlando, the doctor had bought the practice from a doctor who'd been there for 25 years. So the
Mm,
building was 25 years old. And she told me, she said, yeah, the service technician, when he came in, he said, we really need to replace this vacuum pump.
okay.
And they were experimenting with a number of different aerosol devices that can be
Mm,
attached to the high volume evacuation to improve the removal of the aerosols. So this was as they reopened after
yeah,
closure for the pandemic. And she said,
right.
yeah, I'm probably going to need to invest in a new vacuum pump.
Mm, okay.
Yeah.
Okay. So it doesn't just end there. So what about when they're actually caring for the patient? What are the options with using evacuation?
Well, obviously, we'd like to use the high volume evacuation versus that slow speed or narrow. And it's been
Mhm.
difficult to use the high volume evacuation unless you have some sort of attachment that allows the solo orthodontic assistant to work alone, because the dentist uses high volume evacuation and there's always a second assistant there
Mm,
to hold the high volume
yeah,
evacuation.
yeah.
So a number of devices have been created. NOLA suctions, one that we've talked about, with the
Mhm.
tubing. Exuction is another device that has the attached cheek retractors, and
Mhm.
then it uses high volume evacuation that has a larger capture device right at the lower lip. And so that helps to capture more of the aerosols that are created, say, during a debond procedure,
Okay.
where
Okay.
the doctor's using a high-speed handpiece. Whether or not they have water going through there, then there are a number of aerosols that come from that.
Right.
So exuction's been one, relief. There's another device, isolite. I think that's going to be, the isolite doesn't provide full access to all of the teeth for
Oh,
that
okay.
bonding or debond. And
Okay.
then when I was attending the OSAP boot camp, I went to all of the virtual booths
Mm,
of the manufacturers,
yeah.
and I saw a new HVE tip that has been introduced that I think will work really good for an orthodontic assistant.
Okay.
And the reason it will is because it's half the length of the traditional. The traditional HVE tip is about 5 inches long, four to
Okay.
5 inches long. So if you're holding that and you're trying to sit with a patient, then you're sort of your elbows at an awkward position and you're
Mhm.
far back. This HVE solo tip is 2.5 inches long, and the mouth of the HVE solo tip is not just a straight tube that is normally 8 millimeters to 10 millimeters in diameter. They've actually made it like a funnel or expanded it as a capture device,
Okay.
almost doubling that amount of capture with it. And so if you're using that, not only are you getting that 80 to 94% that I quoted from the journal
Mhm.
publication article, then you've actually increased the volume. And in one of the studies, it was shown that if you increased the capture device volume, say to 6 inches, that
Uh-huh.
you can have a 22-fold increase in the amount of aerosols captured.
Oh, wow. Okay.
That's huge. But now imagine 6 inches. 6 inches right here next to the mouth,
Yeah.
it denies access for the doctor or the orthodontic assistant. It gets in the
Mhm.
way,
Right.
of trying to care for the teeth. So that's why I like this HVE solo tip, that it did increase the capture device
Mhm.
without getting in the way. And it would be real easy for an orthodontic assistant to use this type of tip, say if only one bracket needed to be bonded.
Ah, okay.
That's when it's really challenging.
Yeah.
Orthodontic offices, for doing their bonding and their debondings, many of them have set aside a separate chair, maybe have a
Right.
negative air pressure room, as we saw in
Mhm.
Dr. Boyd's office when we visited there and took the photos and the
Yeah.
videos with it. But very often you may have had a patient scheduled in one of the open bay chairs, and it was for an archwire check or an aligner check, and maybe
Yeah.
one of the buttons needs to be moved or changed, even
Mhm.
with the aligner
Right.
checks with it. And so that's going to need to be that button or that bracket. We need to remove all of the existing cement from the tooth, and that requires a handpiece.
Mm.
And when you pick up that high-speed handpiece, that's where the aerosols go. But it's
Okay.
only one tooth. So you don't want to
Right.
go and create a whole dry field with like the exsuction or the
Mhm.
NOLA suction. And that's where I thought something like this short, high volume evacuator with a larger capture device would be ideal, because as I'm cleaning off the cement, rinsing that tooth, and
Mm.
drying it, I can hold that tip right close, say it's a cuspid, right underneath it, and I get that 80 to 94% additional aerosol capture just
Okay.
by using that capture device. So I think what right now that's a consideration, and what
Mhm.
many orthodontic assistants and orthodontists are missing at this time, as we're almost a year into the pandemic, is that there are no live meetings.
Right.
And when we've had live orthodontic meetings, the AAO or the PCSO or GLAO, all of the component meetings,
Mhm.
we're able to go to the exhibit floor in between the courses, and where there's something new like these extraoral suction devices or the HVE capture devices, that you can try them out on the exhibit floor, get a sample, and take it back to your office. So at this time, I'd highly recommend to any of the team members to contact the manufacturers and say, hey, can I get 3 or 4 of these to try in our office and see if it works with our equipment?
Yeah.
Does it work with the way that we schedule our patients? And
Mhm.
or to talk to your sales representative when they come in, because I think we're all missing the exhibit floor,
Yeah.
where we learned about new products from the manufacturers, and what can we do with our existing facilities. So
Mhm.
the high volume evacuation, very important for controlling the aerosols during this airborne disease transmission with the pandemic. And I think it's time to revisit it. Make sure you're cleaning it, changing your filters, have it on your maintenance schedule, and that you're getting the maximum suction from it for each of your procedures where you're going to need that aerosol reduction. Yeah.
Yeah. Well, Jackie, I think this is great information. So thank you. I think it was really valuable to our audience. We will be back next week for our next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or for the latest orthodontic industry news, visit orthodonticproductsonline.com. Until next time, take care and stay safe.